Hello, and welcome to American CME's training course on the Rescue CPR System. I'm David Mills, CPR instructor. Performing high-quality CPR is essential if our patients are to have any meaningful chance at surviving cardiac arrest. Thankfully, there are many tools that can help us get it right. We now have a newly approved technology that provides intrathoracic pressure regulation, or IPR therapy, to help make high-quality conventional CPR even better. The Rescue CPR system is comprised of the Rescue Pod ITD-16 and the Rescue Pump ACD CPR device. This device combination is the only CPR adjunct with an FDA-approved indication to improve the likelihood of survival in adult patients experiencing non-traumatic cardiac arrest. In fact, a prospective randomized clinical trial demonstrated that performance of Rescue CPR resulted in 49% improvement in survival to 1 year compared to conventional CPR. The goal of this course is to provide you with essential information about the Rescue CPR system, but it is intended to accompany a hands-on skill session that will allow you to practice using both devices. This didactic presentation and the hands-on session are both critical components to learning how to perform Rescue CPR properly. And while this presentation is consistent with the manufacturer's recommendations, it's important to understand the product's instructions for use, as well as follow your facility's policies and procedures. This Rescue CPR System course is specific to the use of the Rescue Pod ITD-16 with the Rescue Pump ACD CPR device. By the end of this course, you will understand the relationship between intrathoracic pressure and blood flow, understand how IPR therapy improves blood flow, understand the physiology of CPR, understand how the Rescue CPR system provides IPR therapy during cardiac arrest, and finally, understand how to perform Rescue CPR. It's essential to understand the vital interactions between the respiratory and circulatory systems, because the body regulates pressures inside the chest in order to influence blood flow and perfusion. As blood travels through the circulatory system, perfusion takes place. Perfusion means that blood is flowing to the tissues to deliver oxygen and nutrients to the cells. This circulation also picks up waste products such as lactic acid and carbon dioxide for elimination from the body. All organs of the body need adequate perfusion in order to function properly. The body continually regulates circulation by using positive and negative pressures inside the thoracic cavity. Let's look at how intrathoracic pressure regulation helps to maintain equilibrium. When a healthy person inhales, the diaphragm moves down and the chest wall moves out. This chest expansion creates a vacuum or negative pressure that draws air into the lungs and pulls blood back to the heart. This vacuum also slightly lowers intracranial pressure, or ICP. Reducing ICP lowers the resistance to forward blood flow and improves perfusion to the brain. As a person exhales, the diaphragm moves up and the chest wall moves in. This creates a positive pressure that forces air out. However, this positive intrathoracic pressure also inhibits blood flow back to the heart and slightly raises ICP. When we exert ourselves, metabolic needs change, and the body regulates intrathoracic pressure to meet these increased demands. To compensate, we breathe harder, faster, and deeper, enhancing the vacuum in the chest. This pulls more air into the lungs, more blood back to the heart, and lowers ICP. The net result is improved vital organ blood flow. This compensation also occurs during shock. As tissue perfusion drops, the body attempts to maintain blood flow by increasing the respiratory and heart rates and by constricting peripheral blood vessels. But if the cause of the shock is not reversed, the body eventually loses its ability to compensate and the blood pressure falls and perfusion is compromised. Intrathoracic pressure regulation, or IPR therapy, is used to enhance negative intrathoracic pressure to help the body help itself during states of shock and cardiac arrest. Studies show that IPR therapy does this by providing a slight amount of therapeutic resistance to the influx of air. This enhanced vacuum pulls more blood back to the chest and heart, increasing preload and cardiac output. It also lowers ICP, making it easier to circulate blood to the brain. Think of IPR therapy as the opposite of CPAP, which delivers positive pressure to patients with congestive heart failure in order to drive fluid out of the lungs and lower blood pressure. In summary, IPR therapy provides an innovative way for the body to leverage its own natural